Dr. Radika Balu. I'm one of the GPs in Harrow. I've been a GP for about 14 years. It has been quite difficult over the last 18 months. It's not a pandemic that I had envisioned how it would be. First wave was the hardest for me. So to see patients that sick was really difficult. To lose a lot of patients was even more difficult. It felt like losing one of mine. Whenever I saw them, it just actually, it's even more difficult to think about the faces of those patients actually. The second wave was, yes, we had a lot more patients that we lost during that time. But the one thing that kept me going was the start of the vaccinations, which felt like it was a way out of the pandemic. And I had concentrated my energies on the vaccination and also while working in the COVID hub. So it felt like, we are on the way out and there is something actually. Now during the third wave, it's, I would have felt like we've come out of it, this is it, this is the end of it. But I'm still seeing patients who are sick, the unvaccinated patients. Patients who in the 50s and 60s who should not be going through what I had seen during the first and the second wave. And it's heartbreaking for me as a clinician. And if they had taken the vaccinations, probably they will not be in the ITU bed. Probably they'll not be needing the oxygen. And that makes me worried for the next 4 to 5 months because we are going to have resurgence of flu. And if we are going to have unvaccinated patients being very ill, it feels like I have failed in my duty as a doctor, or probably working for the Harrow CCG or Northwest London CCG. I failed in my duty to protect my patients. Personally, I'm a doctor by profession, but I'm a mother, I'm a daughter, I'm a sister, I'm a wife. It was very difficult. I had to prepare, and I had prepared myself to be part of the COVID hub where I would be facing the danger. It also felt like I would be bringing the virus back home and I might actually cause harm to my family. I had to isolate myself from my family, not be probably socially distanced and talk to them through the phones while living in the same home. Your food actually delivered one floor down, you come in and collect it. You don't get to physically touch or hug somebody while you're staying in the same home for nearly 5 months or 6 months. We had a Zoom call as brothers and my siblings and cousins together, and what we were all telling each other was, look after yourself. Have we actually done everything that we can? There be even if something happens to us, the family should not suffer. Have we looked at everything, tied all the loose ends? Conversations, I don't even want to remember it. I hope we never go through it again and we never go through a pandemic again. That is what I would wish for. As we had vaccinations, I was telling everybody in my family. There's a lot of apprehension about it. I'm the only medic in my family apart from my husband, in his side. So everybody else were frightened about actually getting the vaccination. So I had to be the first one to get it. And even when I was getting it, people were worried. Like I said, my mom was worried, my brother was worried, everybody was worried that I'm experimenting with my body. I should wait till it actually, till probably for another 2 months or 3 months. But I felt like, even living was an experimentation for me. So I felt like, okay, let's go and get it done. And once I got it done, I made sure that everybody else had it when their turn came. So when my mother's turn came in March, I made sure that she had it. When my brother's turn came in actually June or July, he had it. Made sure that his wife had it. Made sure that all my cousins and everybody had it, whichever country that they were in. And I tried my best actually with my patients as well. And if I could, I probably sent a lot more text messages than I should, to my patients, telling them, urging them to come in, urging them to actually have their vaccinations. We know that there is a difference in the death rates due to COVID in different communities. So if you belong to a BAME community, you're more at risk of dying or having actually, complications from COVID. What I'm seeing now during the third wave is the unvaccinated lots are the ones who are presenting with COVID, and I definitely want them to be actually protected for the next wave that we are definitely going to see. or probably, the cases that are going to happen in the next 6 months. And we want them to be actually protected, and I want that for my patients. That's the only reason. The other reason is we seem to have more of diabetes, we seem to have more of actually chronic diseases, which increases our risk of actually having complications from COVID. Let's get the vaccination done. If I am willing to vaccinate my mother, my brother, my sister-in-law, my son, if he's 15 years old, and if the government says yes for a 15-year-old to have vaccination, I will take him. I've had a discussion with him. I've said, your risk of actually dying might be negligible, but your risk of transmitting the virus to your school teacher is high, to your friends is high. I would want you to think about the society, not just about yourself. We've got long COVID clinics as well in Harrow, in the COVID hub. And what I've seen is you don't want to be actually going through long COVID at all if you can. It's just the physical actually symptoms that you get from COVID. If it can be prevented by vaccinations, get it. Get the vaccination done.